Okay, we have here the summary of the different classification of coagulation factors according to their group. So we have here your fresh plasma. So basically all your coagulation factors would contain here all the coagulation factors could be found here in our fresh na plasma. That's why if the patient would have here multiple coagulation factor deficiencies, so ang binibigay natin na gamot for that is in the form of your fresh frozen na plasma. So it's fresh frozen plasma is a type of the unit of the blood in the blood bank. So basically, that would help here the patient to have or increase their coagulation factors concentration. Okay, so we have that one fresh plasma contains all coagulation factors. H, we have also here your H plasma. Okay, H plasma. It eventually would have here the absence of your factor 5 and your factor 8 because factor 5 and factor 8 are labile factors. Kapag sinabing age na plasma, so ay hindi siya fresh, so matagal na plasma, that would eventually result here to the deterioration of your factor 5 and factor 8 because we consider the factor 5 and factor 8 are considered to be the labile factors. Adsorbed plasma. So, again, adsorbed plasma, wala tayong makikita na fibrinogen na prothrombin group. Again, your prothrombin group includes your factor 2, 2, 7, 9, 10. Okay, factor 2, 7, 9, 10. Okay, ulit para factor 5, factor 8, 2, 7, 9, 10. 1, 5, 8, 13, 1, 2, 5. Okay, so again, your adsorbed plasma would have you the absence of your adsorbable group or your prothrombin group. So it would have you the absence of your 2, 7, 9, 10. Fresh na serum, so we are expecting that one to have you the absence of our fibrinogen group because again, your fibrinogen group, they are consumed during clotting process and therefore would have you the absence of your factor 1, 5, 8, 13. Age na serum on the other hand, so it would have here your okay, 1, 5, 8, 13 plus your factor 2. Okay, plus your factor 2. Okay, so that would have here the absence. Wala tayong makita na age na serum. So you need to understand this one because we'll be using this one when we are doing the mixing studies. This is one of the tests in order for us then to identify if what coagulation factors ang deficiency or absence sa patient natin. Okay, labile factors includes your factor 5 and factor 8 because basically they tend to deteriorate on the storage. Okay, factor 2 on the other hand is being consumed here, 80% consumed during the clotting process. Okay, now we go to your factor 8 von Willebrand factor. Okay, so your factor 8 von Willebrand factor, they tend to circulate in the plasma bound to each other, so magkadikit sila. And they could be hydrolyzed or cleaved by your thrombin. So pwede silang mahati. They would tend to separate from one another here by the action of your thrombin. Okay, the factor 8. So factor 8 is actually the type. This is one of your coagulation factors wherein the production or the inheritance of that is sex link. So it's a genetic inheritance. Okay, so pag sex link, most likely ang ating deficiency of that would be highly dependent na ang ating recessive carrier. So this is a sex link carrier. Sex link recessive. Okay, so if the patient would have a recessive na gene containing the abnormality that usually from the mother, okay, ang affected dito ang lalaki, ang magmamanifest ng hemophilia. Okay, hemophilia A is deficiency of your factor 8. Hemophilia B is your deficiency in your factor 9. Both of these coagulation factors, factor A and factor 9, are actually sex-linked inheritance. Okay, then we have also your another, so bound ang ating factor 8 with your von Willebrand factor. So what is your von Willebrand factor? Von Willebrand factor is being produced by our megakaryocytes and your EC or your endothelial cell. And basically, this one is being produced in a large subunit. Okay, then it's being stored in the alpha granules of your platelets. So, tinatago siya doon. Plus, could also be found here. Could also be stored in the Weibel pallid bodies of our endothelial cells. So, once released in our circulation, so large subunit pa din ang von Willebrand factor, you need to degrade that one. So, kailangan natin itong Adams TS13. So in order for you to cleave your larger subunit of your von Willebrand factor to become smaller subunit. So eventually, pag wala ka nito, ano mangyayari? The larger subunit, hindi siya ma-convert into smaller subunit. Pag sobrang laki ng ating von Willebrand factor, ano siya, magiging thrombotic tendency siya. Pagka-clot formation patient natin, the patient would have your prone to your stroke or your other cardiovascular disorders. Okay, so we have here the receptor for your von Willebrand factor. So, there are two receptors for the von Willebrand factor in the platelets. So, pwede ang von Willebrand factor natin mag-bind sa platelet membrane kasi pwede siyang meron siyang receptor doon in the form of your GP1B95 complex, which is needed here for magbabind siya sa ating collagen that would allow here your platelet adhesion. Pwede rin mag-bind ang ating von Willebrand factor na GP2B3A. Okay, which is needed for your platelet aggregation. Another one, may receptor din ang ating von Willebrand factor with your collagen. Another one is ito. So eventually, dito siya, pwede siya mag-bind sa ating factor 8 to form here your factor 8 von Willebrand factor. Okay, deficiency of your von Willebrand factor that's associated to your von Willebrand disease. In the case of your von Willebrand disease, so that is characterized by the decrease in the von Willebrand factor concentration. Since pag ang complex natin na factor 8 von Willebrand factor, between the two na complex, mas malaki ang von Willebrand factor natin compared to your factor 8. And therefore, pag ang patient natin ay von Willebrand disease, so automatic na mababa ang kaniyang von Willebrand factor, so mababa din ang ating factor 8. Kasi between the two, mas malaki ang structure ni von Willebrand factor. Pero pag ang patient natin may hemophilia A, okay, hemophilia A is just deficiency ng factor 8. Okay, ang von Willebrand factor natin for that ay normal. So unfair siya kung ma-deficiency siya ng von Willebrand factor. In the case of your von Willebrand disease, kasama si factor 8 ang mababa. But in the case of your hemophilia A, mababa ang ating factor 8 concentration, pero si von Willebrand factor ay normal ang kanyang concentration. So magkaiba ang treatment ng ating factor 8 deficiency or hemophilia A with your von Willebrand disease. But basically, the two tend to circulate in our plasma. They are bound to one another. Okay, so basically, pag ang von Willebrand disease, ang ating treatment for that, you give von Willebrand factor concentrate. On the other hand, you could, pag ang patient natin ay may hemophilia A, so ang treatment natin ay anti-hemophilic factor A. Okay, your factor 8 concentrate. Ang ibinibigay natin, hindi yung von Willebrand factor na concentrate. Okay, another one, we have here the group of your anticoagulants, your coagulation factors, and they are considered here as our vitamin K dependent coagulation factors. Your vitamin K dependent coagulation factors includes the following: factor 2, 7, 9, 10, protein C, protein S, protein Z. These are actually your prothrombin group or your adsorbable group. Okay, so these are coagulation factors on their terminal end, sa dulo ng kanilang structure. They have approximately, there are 10 to 12 na glutamic acid. Okay, tinawag silang vitamin K dependent coagulation factors because in order for these coagulation factors to be activated, it requires the presence of your vitamin K. So pag walang vitamin K, hindi sila magiging activated. So vitamin K is needed here for their gamma carboxylation process. Your gamma carboxylation process involves the addition of the second na carboxyl group dito sa kanilang terminal glutamic acid na terminal end. Okay, so kailangan natin ng vitamin K for this one to become activated by addition of your second carboxyl group in the process. We call that one as your gamma carboxylation process. Before we go with the gamma carboxylation process, so we have here your vitamin K. And vitamin K here, the sources of that, we have your green leafy vegetables, we have here Bacteroides fragilis, and we have Escherichia coli, which are your intestinal bacteria. So it contains also the vitamin K. Okay, now we go to your gamma carboxylation process. Again, gamma carboxylation process is just the addition of your second carboxyl group, and then, but you are needing here the presence of your vitamin K. So vitamin K in the form of your vitamin K hydroxyquinone, okay, that will be converted to your vitamin K epoxide by the enzyme epoxide reductase. Then, pag na-convert na siya dito, so kailangan mo ng enzyme na carboxylase para mag-add ka ng second na carboxyl group. Ang second carboxyl group dito ka sa glutamic acid ng mga ito. So, dito siya mag-add. Okay, so dito siya mag-add sa kanyang terminal end. Dito siya mag-add ng second na carboxyl group. For that, to undergo here your gamma carboxylation. Again, gamma carboxylation is just addition of the second na carboxyl group. Bakit ka mag-a-add ng carboxyl group? So remember, carboxyl group is negatively charged. So pag nag-add ka ng carboxyl group, it will allow this factor 2, 7, 9, 10 coagulation factors mag-bind sa ating calcium and eventually mag-bind sa ating phospholipid para magiging activate. Para ma-activate sila, para magkakaroon ka ng clot formation, para ma-convert mo ang fibrinogen to your fibrin clot. And that would eventually result here to your thrombin. Activation of your coagulation factors result here to your production of your thrombin para ma-convert ang ating fibrinogen to your fibrin clot. That is needed para mag-activate ang ating coagulation kinase complex. Pag na-activate ang coagulation kinase complex, makapag-produce ka ng thrombin. Ang thrombin ay gagamitin natin para ma-convert ang fibrinogen to your fibrin and therefore magkakaroon ng clotting process. Okay, so again, those are needed here for your vitamin K-dependent coagulation factors. Again, they require your addition of your second carboxyl group with the use of your vitamin K. And therefore, you call them here as the vitamin K-dependent coagulation factors. On the other hand, the presence of the oral anticoagulant na comadine or warfarin, okay, we consider this anticoagulant here as your vitamin K antagonist. As sabing vitamin K antagonist, it try to inhibit the activity of your vitamin K. Paano niya in-inhibit ang ating activity ng ating vitamin K? So, it try to inhibit this enzyme, epoxide reductase. So, by inhibiting the enzyme, epoxide reductase, hindi ka makapag-add. Eventually, hindi siya makapag-add ng second na carboxyl group. Pag hindi siya makapag-add sa second na carboxyl group, hindi siya magiging negatively charged ang ating mga coagulation factors 2, 7, 9, 10, protein C, protein S, and protein Z. And therefore, hindi siya makapag-bind sa calcium natin and with your phospholipid, and therefore, hindi sila magiging activated and wala kang clot formation. Kaya nga, magiging consider siya as your anticoagulant. So, paano siya nagiging anticoagulant ang ating warfarin comadine? It try to inhibit here the epoxide reductase, which is needed for the gamma carboxylation process for your vitamin K dependent coagulation factors. And therefore, we consider this one as warfarin comadine as the oral vitamin K antagonist or vitamin K antagonist. Pag hindi siya nag-undergo ng second na or addition of a second carboxyl group, in the process you call that one as your gamma carboxylation process. Anong tawag sa ating mga mga coagulation factor? You call that one as your protein and vitamin K antagonism or des gamma carboxyl protein. Ang protein in vitamin K antagonism or des gamma carboxyl protein are your coagulation factors na hindi siya nag-undergo ng gamma carboxylation process. Mean to say, hindi siya nakapag-add ng second na carboxyl group and therefore, hindi sila magiging activated and therefore, hindi sila magkakaroon ng clot formation and serving that one as your anticoagulant. Okay, speaking of our coagulation kinase complex, your coagulation kinase complex, the combination of your serine protease. Another one, we have also here your cofactor. We have also the calcium and phospholipids. So again, coagulation kinase complex, in the case of your coagulation, vitamin K dependent coagulation factors, they could form here kinase complex once it undergo gamma carboxylation process with addition to a second carboxyl group. So we have here different kinase complex. First one, we have your extrinsic kinase. Extrinsic kinase made up of your factor 3 and factor 7 plus your calcium phospholipid. And the substrate for that includes your factor 10 and factor 9. Okay, for this one, the serine protease for this one, okay, is your factor 7. The factor 3, consider here as your cofactor. Another one, intrinsic kinase. Again, this was made up of factor 8, factor 9, calcium phospholipids. Ang ating serine protease for this one is your factor 9. Ang ating factor 8, ang kinoconsider natin na cofactor with your intrinsic kinase complex. Okay, the substrate for that is your factor 10. And we have also here your prothrombinase, basically made up of your factor 5 and factor 8. So factor 5 is considered here as our cofactor, and your serine factor 10 is your serine protease. That's what we have discussed kanina sa classification ng ating coagulation factors as serine protease or your cofactors. And we have also here calcium phospholipid pa din. Okay, and we have also here the substrate for that, we have your prothrombin. So upon activation of this one, result here to your prothrombin, magproduce ka ng thrombin, which eventually converts your fibrinogen, and therefore you have here your fibrin clot, and that result here to your clotting process. Okay, the next group here of your coagulation factors, we have here the contact factors. So contact factors here, contact group, basically tend to be activated upon contact with your negatively charged particles. Again, your contact group includes your factor 12, your prekallikrein, and we have also here your high molecular weight kininogen. So basically, again, they tend to be activated upon contact with your negatively charged particles. Your negatively charged particles could be in the form of your in vitro, that's in the form of your non-siliconized glass, your kaolin, ciliate, and ellagic acid. These are actually considered to be as our activators. These are reagent natin, component ng reagent natin when we are performing your APTT or activated partial thromboplastin time. So, itong component ng reagent na deserve here as our activators to activate our contact factors. Basically, activating you starting with your factor 12 na activation. Inside your body, your negatively charged particle here could be in the form of your stent, mga artificial na devices na nilagay sa katawan ni patient. So, that's your stent. Pwede siyang heart processes. So, upon contact with these devices, pag na-activate ito, so clotting process siya, so magiging thrombotic ang ating patient. Okay, then we have here how is your contact factors being activated. So start here with upon contact with your factor 12, upon contact with any of this one, either in vitro or in vivo, this will convert your factor 12 to your factor 12A. A stand for activated na factor 12. Once you have already your factor 12, activated na factor 12, it will activate, so convert your prekallikrein to your kallikrein. Then your kallikrein circulate in your circulation bound to your high molecular weight kininogen, which further converted one to your bradykinin. And further, it will activate your factor 11, okay, so 9, 8, then eventually your common pathway 10, 5, 2, 1. And again, 1 is your fibrinogen, so fibrinogen will be converted to your fibrin clot, and that's also here to your clot formation. Okay, so we have this one. Okay, so basically we have the deficiency of your factor 11. Okay, factor 11 is your Rosenthal factor. So deficiency of that results to your hemophilia C. And therefore, we are expecting here that the patient would have a bleeding manifestation because again, that one is your hemophilia. But in the case of your deficiency of factor 12, your prekallikrein, high molecular weight kininogen, so wala silang bleeding manifestation. Okay, now we go to your fibrinogen. So again, we consider fibrinogen here as the ultimate substrate for our coagulation process. So again, clot formation would try to convert your fibrinogen to your fibrin clot by the action of our thrombin. Okay, so your fibrinogen is a trinodular, ito say 3 peptides, polypeptides. Label here is the alpha, beta, and gamma. And at the middle portion, we have here the amino group. And let's consider here the bulky area. And we designate that was your E domain. And terminal end naman, may mga D domain, which consider here the carboxyl na group. Okay, so how then our thrombin will able to convert your fibrinogen to your fibrin clot? Paano siya nagkakaroon ng clot formation? Okay, your thrombin is basically being activated by, your thrombin. Okay, so we have here the steps for the clot formation by the action of your thrombin. First, we have here your thrombin try to cleave your fibrinogen by cleaving the fibrinopeptide A and fibrinopeptide B. So this is your at the middle portion here in the E domain. So this is the fibrinopeptide A in the alpha na polypeptide. Fibrinopeptide B is in your beta na polypeptide. So ang ating thrombin, gagawin niya ay try to hydrolyze this area, which eventually try to expose your E domain. Pag na-hydrolyze niya ang E domain here or the fibrinopeptide A and the fibrinopeptide B, kaya exposing the E domain, you call it was your fibrin monomer. Then after that one, so pag meron ka isa dito na fibrinogen, so dito sa kabila meron ka ding fibrinogen, dito sa kabila meron ka ding fibrinogen. So each of that one, after action of your thrombin, will tend to hydrolyze the corresponding na fibrinopeptide A and the fibrinopeptide B of each of your fibrinogen, which eventually try to expose the E domain. So, parang ganito. Then, so dito sa kabila, ang D domain nito, so wala din ito. Ang D domain dito, mag-attach dito sa E domain nitong na-expose na E domain by the action of your thrombin. Pag nag-attach siya dito, it become here your fibrin polymer. Pag dalawa lang sila, magiging fibrin dimer. Pag madami na sila, nag-attach to one another. So, paano kanilang attachment? So, okay, we have that one, your D domain ng isang fibrinogen, mag-attach i-expose na E domain ng another one to form here your fibrin dimer pag dalawa sila. Pag dumami sila, then become here your fibrin polymer. And therefore here, hindi lang yung enough na magkakaroon ng fibrin polymer, you need also to undergo cross-linking or polymerization by the action of our factor 13. So para mas stable ang clot na ma-form natin sa pag dumami ito, magiging clot na sila. Okay, and eventually, para maging stable na clot siya, it should be acted upon by our factor 13. Para ma-activate ang ating factor 13, so from your factor 13, okay, so magiging activated factor 13A siya, so kailangan natin ng thrombin. Okay, so once your factor 13 is activated, ang ginagawa, ano ulit ang function ng factor 13? It try to be transglutamates, transamidase. So, mean to say, try to cross-link mga ito para mag-cross-link, mean to say, try to bind para maging stable ang clot natin. Okay, without your factor 13, hindi magiging stable ang clot. Pag hindi siya maging stable, magbi-bleed pa din ang patient natin. So, mean to say, kasi hindi stable ang fibrin clot na na-form mo. Okay, again, kailangan natin factor 13 to make that one more stabilized. And after that one, additional proteins, mga adhesive protein natin like your fibronectin, and even your alpha-2 antiplasmin is being incorporated as well in your fibrin na stabilized clot. Okay, alpha-1 antiplasmin would prevent the action of your plasmin. Ang plasmin natin ay ginagawa niya, they try to dissolve your clot. So, para hindi siya agad ma-dissolve, okay, para mag-stop ang bleeding effectively, so, mag-incorporate ka ng alpha-1 antiplasmin. After which naman, pag nag-stop ng bleeding, ang clot na na-form natin, i-dissolve pa din natin by your fibrinolysis. So, yun na kailangan na natin ng plasmin. But, for the meantime, since nagpa-form ka pa ng stable clot, para hindi siya, para mag-stop ang bleeding, so, kailangan mo muna nito alpha-1 antiplasmin to be incorporated in your fibrin, stabilized fibrin clot, after the action of your factor 13, plus also the addition of your fibronectin. Okay, so we have here the factor 13. So again, factor 13 or the fibrin stabilizing factor or the Lacky-Lauran factor. So again, we are needing the factor 13 in order for you to have a stable na clot formation. So deficiency of your factor 13, but before that one, so the factor 13 is made up of two subunits, the alpha and the beta subunit. The alpha subunit is produced by your megakaryocyte and your monocyte. The beta subunit of your factor 13 is produced by our liver. Okay, deficiency of your factor 13 would eventually result here to pag wala kang factor 13 na mangyari ay hindi magiging stable ang clot natin. So, meaning to say, hindi pa nag-stop ang bleeding ng patient natin. So, deficiency of that would result here to your moderate to severe systemic bleeding with your poor wound healing. Ito kasi nag-heal agad, hindi talaga nag-heal ang sugat ni patient kasi hindi siya stable ang clot formation. So, hindi pa siya masyado nag-stop ang bleeding. It's because here na wala kang factor 13 to stabilize your fibrin polymer. That's why, very important ang role ng ating factor 13. Okay, then we have also here the activation of coagulation factors. So, again, yung intrinsic pathway ulit as a review starts with activation factor 12, 11, 9, 8, proceeding with your common pathway, 10, 5, 2, 1. Extrinsic pathway will start with activation of your factor 3, factor 7, and then try to proceed here with the common pathway, factor 10, 5, 2, 1. We have also here the tests that would help us to diagnose problem related to your intrinsic pathway. So we have your activated partial thromboplastin time. So any problem related with the coagulation factors 12, 11, 9, 8, magiging prolong ang result ng ating activated partial thromboplastin. On the other hand, if you have a problem with your factor 3 and 7, it would have here a prolonged result with your prothrombin time. Okay, then we also here the cell-based coagulation. Okay, so clotting process, 95% of that is occurring in your platelet membrane. Whereas 5% of that is occurring here in your tissue factor bearing cells. So majority of your clotting process, again, pag nagka-clot tayo, nagpo-produce tayo ng thrombin. So majority of your thrombin is being produced here by activation of your platelet membrane, whereas only 5% of your thrombin is being produced here out of your activation of your tissue factor bearing cells. Your tissue factor bearing cells could be in the form of your fibroblasts or even your smooth muscle cells that contains the tissue factor. Even your WBC also contains your tissue factor. So, pag nagkaroon ka ng inflammation, nagiging activated ang ating tissue factor. So, we have here the steps for the coagulation process. The first one, initiation phase. Initiation phase here occur in your tissue factor bearing cells. It starts with the tissue injury, exposing your tissue factor. Ang tissue factor is factor 3. Once exposed, magbabay ng ating factor 7 because cofactor na ito, diba? So, once activated, factor 3, 7. Okay, magpo-proceed na dito, 10, 5, 2, 1. And therefore, magkakaroon ka ng thrombin and therefore, you have your clot formation. Ang thrombin na mapoproduce out of this initiation phase, ang initiation phase occur in your tissue factor bearing cells. So, saan ginagamit ang thrombin na produce dito? So, number 1, it activates your platelets by binding with its receptor in a platelet, the PAR1, PAR4. Again, PAR1, PAR4 as a review. Those are the ligand na ito ang receptor binding site ni ating thrombin sa platelet membrane. Another one, thrombin, pwede siyang activate your factor 5, activate your factor 8, factor 11. And ang pinaka-function ng ating thrombin, ginagamit natin siya para mag-hydrolyze ng ating fibrinogen. And therefore, you're able to form here your fibrin clot.